effective today, my administration is officially declaring the opioid crisis a national public health emergency under federal law, and why I am directing all executive agencies to use every appropriate emergency authority to fight the opioid crisis. This marks a critical step in confronting the extraordinary challenge that we face.
President Trump declaring a public health emergency on opioids. Federal agencies will now have more resources to address the drug crisis and target companies that are fueling this epidemic. Oklahoma Attorney General Mike Hunter is suing multiple drug companies, and he joins us now in an exclusive interview. Mike Hunter, thanks for joining us. Oklahoma, especially hard hit by the opioid crisis. Today you convened your third meeting about the abuse of the drugs. Tell us how it went.
Well, Charles, today we heard from the medical community. They provided us a framework for how they believe the medical community can do more to stem the crisis. There are opportunities with e-prescriptions, so we're getting away from fraudulent paper prescriptions, getting a tougher prescription monitoring program. And I have to say the medical community in Oklahoma is collaborating in a thoughtful, positive, constructive way, and hats off to them.
Within the medical community, a lot of finger pointing now. Some doctors may point to drug companies may point to pharmacies may point to doctors. And it feels like this sort of circular firing squad. No one wants to take responsibility, but you've zeroed in on pharmaceutical companies. I know amongst the ones that you filed suit in, J&J, Purdue, Cephalon, Teva, Allergan. Why specifically the companies that are making these pain medicines?
Those manufacturers have been systematically defrauding and misrepresenting the addictive qualities of opioids for the last 2 decades. They've spent millions of dollars to accomplish this, to create pseudoscience, to pay people to generate opinions that misrepresented the addictive qualities of these drugs. And unfortunately, prescribers relied on those misrepresentations and those opinions that were bought and paid for. But prescribers are stepping up now, largely. We still have sort of a 80-20 rule. 20% maybe of prescribers are creating 80% of the oversupply problem. Those numbers aren't precise, but by and large, doctors are doing what they need to do to take care of their patients. But there's this minority within a minority, and in Oklahoma, we're holding those doctors accountable. On the lawsuit side, Charles, we're confident that those manufacturers are responsible for billions of dollars in Oklahoma taxes going to health care, to corrections, to law enforcement, and we're going to hold them accountable.
Oklahoma Attorney General Mike Hunter, thank you very, very much.